all those need to be put into play, and we need to have clear guidelines that direct us in terms of using these applications and platforms. So I think today, as the youth, we need to engage. One of the reasons why we are converging here, to see how best can we come up, or can we contribute to the regulatory sphere of the country in terms of developing guidelines or regulatory frameworks that can be of that can make sure that whoever uses these platforms or applications within the health sphere, we are safe. We know that wherever our data is going, our data is safe. I don't want on a single day or any other day I find my data that is all over internet and people are using it for different various reasons. Or in case we have issues that we are not getting along with the service provider or the developer who is accessing the back end, my information will not be able to go out there, that it can be used for any other reasons. So I think today, as we deliberate, let's make sure that we generate those ideas. I know the team that is working under this project, they are also conducting a research that I know at an appropriate time you will be called for dissemination of what would be the outcome. And I think this session today also is going to contribute to the research process of this project. But what I leave you with, what you need to know, that digital health security is not more than just information. It's not only more about IT, but it's a spectrum of many areas that we need to think about in terms of policy, in terms of usage, in terms of interconnecting others, in all these aspects that we are talking about. I think with this, I don't want to preempt the next speakers who will be coming on to deliberate on these issues, but I wish you best deliberations of the day, and I welcome you to a haki and wish you fruitful engagements. Thank you.
Thank you very much, Mr. Paguma, for opening up the session. So we are now free to discuss digital things. The session has been opened. The session that is coming next is going to be chaired by our own M&E officer, Joyce Nabalisa. So I'm going to call on Dembe. Andrew Dembe is the CEO and founder of Mobi Clinic. During his introduction, he was very polite. He has not mentioned they have won several awards in terms of innovation. Maybe he will talk about them later, so please take a seat. And the next person that I will invite has actually just arrived, but I will just call him to come and take up a seat, Dr. Miro. He's a pharmacist and a digital health systems enthusiast, and I think I'll just give you like 2 minutes to introduce yourself. And we were introducing ourselves using some of the gadgets that you're seeing there, so you can just pick on one thing that you think speaks to digital health and really speaks to your personality, so that the members can actually know who you are.
Thank you very much. I could stop here, right? So, good morning, everyone. I want to apologize for my time. Commitments in our healthcare. Sometimes you can't forego them. Yeah, so someone would wonder, let me first introduce myself. I'm Miro Kresh, a pharmacist by training, and a passionate researcher in the fields of health informatics, pharmacovigilance, global health, and digital health. Yeah, so someone mentioned digital health, and then I came down here and I picked this. This is because I do digital health, but I also do a lot of equity in health. Yeah, so as you can know that we are practicing in Uganda, to me this is what represents digital health. because the smartphone penetration is still very low. And if we are trying to be as inclusive as possible so that we achieve maximum impact for digital health technologies, then this is what represents us at this stage. Of course, we are shifting towards that, but for now, the population that we serve mostly can only afford to use this. Thank you so much.
Thank you very much, Dr. Miro. And then I'll call on Miss Lillian. Lillian is from CIPESA. I don't know, you call it CIPESA or CIPESA? CIPESA. And Lillian is also the president of the Internet Society of Uganda. So we are happy to have her here. And then we have our very own from our central government, from Ministry of Health, Agaba. You are welcome. He works in the Office of Health Informatics at the ministry, so we are happy to have you here. Please come and take a seat up. So those of you who are familiar with Uganda's healthcare systems, this is the top. From way down the VHT, when you get to the top, our top is Ministry of Health. So Agawa will do best to represent us in that area, and I think they have the mandate to regulate anything that is health related, including the apps that we develop. So Joyce, kindly come and take up this session. You can also take your seat and then you can take it on from here. Thank you.
Good morning, once again. I'll moderate this session. Thank you, Alima, for the introductions. And I think I don't have to make any further introductions because she's already done it. So just a brief about what we're going to do, what we're going to discuss about. I was reading a WHO report, 2022, that is last year. And it says that a total of 6.64 billion people are using smartphones globally. And out of these, 83% of them own the smartphones, but 77 are young adults, and these are 18 to 35 years. And they use these phones to look up health, to access health services. This is globally. In Uganda, it's over 65% of youth have smartphones, own smartphones, and I'm actually not certain of the number that is using the smartphones to access the health services. Maybe the health informatics person, since you're the data hub at the Ministry of Health, you have that information. But I also want to briefly tell us about, so to get the ball rolling, about the digital health. When we talk about digital health, what do we mean? Digital health is anything digital where we can access any service, either a doctor online with you, information, IEC, that is health related. So we have mHealth, we have telehealth, and these are all wireless technologies. We have PDAs, we have mobile phones, all these help in accessing health services and health information. Some of the health apps that I've actually interacted with, I've interacted with M4H. M4H is Mobile for Reproductive Health, which is an app for young adolescents 18 to 25, and they use this app to access health services. We also have Digital Human Rights Lab, which is a mental health service to the youth. This app helps youth access services on mental health. There's a youth who is working in mental health. Then we also have the Girls Globe. The Girls Globe is an app for the youth, and still they access SRH services. Yeah, this is just to set the pace of our discussion. So we're discussing digital health. My first interaction or conversation or question goes to Andrew. Yes, the CEO of Mobi Clinic. I know your journey has not been smooth, but like us in the room, we really want to understand, what does Mobi Clinic do? Tell us your journey. How would you collect this information? Who collects it? And then how is it stored? Let's start there.
Thank you so much, Madam Moderator. Like I was introduced, my name is Andrew Dembe, and I'm the Chief Executive Officer at Mobi Clinic. You've asked me to take you through what our journey has been at Mobi Clinic to date. I think I will start by talking about our vision at Mobi Clinic. Our vision is to revolutionize access to healthcare in low-income areas and last-mile areas of Africa. And today I'm very happy that Ahaki is very Pan-African in whatever they do. I so much believe in African solutions for African problems. So Mobi Clinic started off, it started as an idea in the year 2018, where I had done some work with the African Union and African Leadership Academy. And really, I was able to see that the biggest challenge of the continent is healthcare and health access. And I think we all agree in this room that the pandemic, like COVID, even last year we had Ebola pandemics, and these outbreaks, they always put our health systems to a test. And I think it becomes the homework of us and also the homework of the various stakeholders to come together to think how can we solve our local problems. And I think also as a continent, we need to shift away from always waiting for the white man to come and solve our problems. So that was the drive, the passion behind starting the idea of Mobi Clinic. And it started off by seeing, what do we have? We always talk about the problem of few doctors. When you go out of Kampala and other urban areas, the official statistics say that there's one doctor for about 25,000 people. So even if we waited for the next 100 years, a doctor is going to be enough. I come from Buyukwe, which is 56 kilometers out of Kampala, but it will be interesting to visit the facilities and see the numbers of doctors that are actually in these facilities. So even on top of the few doctors we have, many of them prefer to be in the cities, Kampala, Jinja, Mbara, and you don't blame them. It's because of the socio-economic factors. So we have that as a challenge. And then number two, we realize that the distance, that facilities are far from the people. And when you go down to these areas, in today's time, people are still giving birth at home. People are giving birth in the hands of traditional birth attendants, TBAs. So the problem of healthcare has caused a whole can of worms of more problems. And I must say also that when we deny people access to healthcare, we also cause development challenges, such as overpopulation. You go to these areas and people are just lacking the information and even access to tools about sexual reproductive health and family planning. So having looked at all this and witnessed that it was a shared problem across so many countries in Africa, is when the idea of Mobi Clinic started coming up in my head. And Mobi Clinic is just two things that we started off by advocating for and put in practice. That number one, in Africa, we have a lot of human resource down in our communities. We have people. So how about we partner with the trainers to skill people with a basic health skill set? So our first part of the solution is strengthening community health systems by equipping people with a basic health skill set, such that at the end of the day, there is that knowledge, that health skill set will help somebody respond to basic issues in their homestead, but also to their community. So the first resource we have are the people. And I think the ministry had taken a very great approach of the VHT. It's that same system we're talking about. And it's just that in some areas you find that some VHTs were last trained 20 years ago. And that necessitates that us working with partners to polish their skill set. So we've been working with Clark International University and some other partner training institutions to train people to make this skill set available in communities. So that's number one. But number two, the question is, when you create these first line respondents, time and again, they will interface with situations beyond their skill set. So the second part of our work is what makes us very distinct from so many people who are working in community health and from other organizations that you may have had that are in community health. For us, we recognize that this VHT and this community health worker or first line respondent, whatever you call them, we recognize that their skill set is to a certain limit, and time and again they will interface with conditions in the community that are beyond their scope of training. So how do you then help this first line respondent to still be effective and of help to those people in the communities? That is when we said simply create a digital interface that enables a digital link that enables interface between the first line respondent and the few existing doctors. Now here, when you analyze our model, you realize we are attempting to respond to how do we utilize our few doctors without overwhelming them. So we say empower the community, give the skill sets, create an interface that is from bottom to up. You realize when you go in the communities of our experience, you see that the diseases and ailments in these communities, sometimes they are really basic. But because there is lack of timely consults, what was simple malaria, by the time person A decides to go to the facility, it has become advanced malaria. So how about we start from bottom and create a system that can work for our low resource countries? And that is what we're advancing at Mobi Clinic. So our application can be used by the VHTs or the first line respondents to interface with the doctors for senior guidance, to call for emergency response from ambulances, but also for integrated referral. Now, we don't work in isolation. We onboard existing players, private facilities, public facilities, for instance, in Buyukwe, where we've been working. So we don't work in isolation. We simply are there to realign and push a model that can serve everyone. So that is what Mobi Clinic was. It started off from an idea into practice. In the year 2020, we were voted as the Innovation of the Year. Last year, we were also selected as the fastest rising social enterprise in Africa. We've managed to pick a number of other words that I may forget, but also most importantly, we started off by presenting this idea on a global stage, where in a competition that had been organized by Novartis. I'm sure most of us are conversant with Novartis. It's an international pharmaceutical. And Novartis had asked the question, how can we improve global health access? And this is where this Ugandan idea of what we can do ended up emerging the best out of over 800 ideas from various health professionals. So we are moving the journey, and we're glad to be here. Thank you.
Thank you so much, Andrew. Just in a minute, kindly tell us what kind of information is collected, and how sure are you that this information collected from the VHTs is very safe and secure and not shared with the other clients as it reaches to your system? Just in a few seconds.
Okay, thank you. So when a person goes to the VHT or CHW, I will use the terms interchangeably. The first is to get the basic data, the name, to get the age of the person, what condition are they suffering from, are they pregnant or not. So these are there in our application, and this data is picked up. Now, once that data is picked up, the system generates a code. So on the back end, for us, we only see codes and conditions under codes. So if you are the CHW and I'm your patient, it is you. That's why so far right now, I have to keep my code. You have to remember, one of the two has to remember the code. We are trying obviously to improve on that and to also erase the code. But why we did that is because we are aware of the data protection, that if a patient is at the CHW and manages to open up about their health condition, because we are all aware that there are certain health conditions that trigger stigma in these communities. So we don't want to see on the back end the person's names and this is their condition. That is how so far the data is being managed. So it's the basic data and what their condition is, and even on follow-up. So your medical record is there, but it's anonymized at the back end, that not even Mobi Clinic is getting to know that this is Fred, this is so-and-so, this is David, this is Mary. No. So that really, so far, how we are going about it, because the health industry is overly regulated. So that in one way, that's also a hindrance to innovation, but also you must find how to circumvent and abide by what it is like. So that's how we protect the data. And also the VHT for you, the information of your patients that you're handling, that is now accessible on your account. It's you who's going to know the greater detail on your account. So even the next person who is the CHW is having only the record of their patients that they handle. So that's how we respect the data and try to protect it within our means.
Thank you very much for that elaboration. Having developed, at least I work with systems, simple systems, so I know what a back end and what a front end is. I know the director of programs knows what it is. The rest, I think, will. So we go to Dr. Miro. You call yourself, you are a digital health enthusiast. When I saw this, I was like, okay, maybe you have to tell me what it is. Have you developed an app before? Any digital app before? Or have you assisted in developing? And if you have, kindly share with us, are there any laws that you follow? Are there any restrictions while developing the app? Because most of us have never really developed apps and really want to hear your experience on what procedures you follow as you develop apps. Or whatever you have. If you haven't, then the research that you have done. Thank you.
Thank you so much. Yeah, I'm going to share a few ideas and details of the work I've so far done in the scope of digital health, apps development, and research. So I've been involved in scaling of digital health tools. First digital tool I interfaced with was a tool to report side effects of drugs to the National Drug Authority, whereby, let's say you swallow, which is the most common drug, you swallow paracetamol, you start feeling some dizziness. So this platform was giving you a platform to convey this information to the drug regulators nationally. Yeah, so that's one of the apps that I was involved in. I was involved in its monitoring and evaluation. And so basically this is what I interfaced with that is legally binding. First of all, I have to state that health data and technology are goods and vital goods in healthcare provision. And so we can't do away with them currently. This is the generation we are in. We just have to adapt to this, that moving forward in life, we have to provide healthcare while leveraging the different digital health and emerging technologies. Yes, so first what we have to know is that healthcare has collected the most sensitive data from people. This is not just to do with the apps we use currently. This has been happening before the apps came around. And I want to state that healthcare practitioners have the expertise in data protection. Because the moment you say that I'm going to healthcare, then you have to understand what confidentiality is. You have to understand that whichever information of someone you have, if shared, can have significant consequences for the person. For instance, the app we use to report side, it's called a MediSafety app. It's still, if you could search for it and be able to download it and see how it works. So this app, it was used a lot by HIV patients. So someone comes in like, oh, I took a drug, let's say I took dolutegravir, and then after taking this dolutegravir, I get a what? A certain side effect. So this person reports all this information, is inputting data of the drug they took, the disease they were treating, and all that. So the moment this information leaks, and everyone gets to know that this person has HIV, well, that would be a catastrophe for that person. At least for the very stigmatized community, it would be very bad for them. So what we do in development of these apps, first of all, we ensure that data is always anonymous. Yes. Me, who is sending in this data, I'm the only one who can access my identity. Anyone else can't access my identity. So it's between the the person, the patient, and the service provider. Yes. And this is between the two people. Beyond that, the system, as we say, the back end. The back end we mean where this data is collected. Let's say the dashboard where this data goes. It doesn't reach with people's names. So you find that someone's name is replaced with, let's say, initials, all identifiers, contact details. Contact details can reach, but the name doesn't really reach. And then also, on top of that, those in the back end who are handling this, that even if you have someone's contact, because sometimes we had to reach out. When someone reports a side effect, you have to reach out for further information. We make sure that the person in the back end, he's qualified to do that. He's qualified to interface with this data. So there are many oaths that we swear as we start the practice of medicine. And if you realize, most of these oaths are bound to protection of data for patients. It's very critical, and it's very important. So in my work as a researcher in this field, I also interfaced with the CEO of Mobi Clinic, and I helped with still monitoring and evaluation and research into scaling of the tool Mobi Clinic developed. And I can tell you that in regard to that, still it's the same principles that apply. Confidentiality comes first. You have to make sure that you have data security, because you don't only look at the leakage between individuals supplying data, but then there are unscrupulous individuals out there. Someone is trying to find out, let's say, which particular minister is suffering from what. You understand? You know political games. Someone is trying to find out what is Bobi Wine suffering from, what are Bobi Wine's kids suffering from. So there is people, and the fact that we are adapting these digital health tools, I think every studied person right here has their medical information somewhere. So the moment that your medical information is somewhere there, someone could try as much as possible to hurt you with it, and in so doing, they try to access different domains of data, and this is why we have to make sure that there is security for the data that we collect. And this is one of the things that are analyzed in any application that tries to collect data from patients, especially health data. So, yeah, I don't know if I try to elaborate that. Okay, thank you.
In instances where you're migrating data, like from the community to the head office at Mobi Clinic. Have you experienced or interfaced with a time when you've lost that information? Or you've lost some of the information, of the data? And then, if yes, what did you do? And what was the cause? Because, I mean, those are some of the things that that happen during, migration of data. Data is lost, and you don't even know where it is. You're looking for it in the system, and it is not there. You call to verify in the field, the information is there. And I don't know what you did at that, during that time. 2 minutes.
Thank you so much. At Mobi Clinic, I think that since I started helping out at Mobi Clinic, I didn't interface with such a challenge. But while I worked with the National Drug Authority in implementation of digital health tools from pharmacovigilance, yes, sometimes some data could be lost. It can happen very much. And when this happens, we call for verification. You reach out to the person, the primary source of this data. Usually this is the patient. You reach out to confirm. Of course, when you look at data sets, you can notice discrepancies if you've had experience in dealing with data. So when you notice that, you reach out to the primary data source to confirm if what you have is actually true or not. But what happened, another thing that happens is digital systems are built with a backup system. You build data, you know that you're collecting this data, it reaches the back end, yes, but all this data always has to be backed up. It's a requirement that whichever data you collect is backed up. So because it's not like you always have this, you don't always have an option of reaching out directly to the primary data collector. Sometimes the anonymization process is very stringent that you can't even get a contact of the person who shared this information. So the data backup here is where it serves its purpose, that you can know that in case data is lost, I can actually retrieve it from somewhere. So that's why it's something that is incorporated in all digital health platforms. At least those I've interfaced with. Yeah. Thank you.
Thank you so much, Dr. Miro. So we go to Agaba of Ministry of Health. Being a health informatics specialist, I just want you to help share with us data management and utilization of data, just to start us off.
Okay, thank you. Morning once again. About digital health, like she explained, it really takes care of so many aspects, M-health, E-health, and all that. Whenever you have to use a gadget, a digital gadget, for health data or health management, that is all digital health. So she's asking about data use and data management. So data use and management starts at where they are highlighting the community. So it all starts in the community. That is the first level. And then comes up to, I think, the structure. If I can take you through the structure briefly. You look at Health Center 2, then Health Center 3, Health Center 4, the Health Sub-District, and then the general hospitals, regional referral, national referrals. So that kind of flow is for the health structure, but then for the data it's a little different, because sometimes it doesn't have to go through all that. It may have directed to come to the central repository, the DHIS2, and the other systems that are hosted at the Ministry of Health. So that is to do with the data management. And everyone that has to work with this data has to take care of the security, privacy aspects of the data, especially with data that involves personal identifiable details, like their names, phone numbers, national ID details, and all that. So
whatever interaction you have to have with a patient and patient data, you must make sure all this information is kept in confidence and you're not sharing it for the purpose it was not meant for. Yes? For instance, like Mr. Waguma was telling us, you have collected someone's sample and taken some details. So you must use it for the purpose for which you collected it, and then still use that information for the same purpose and not any other. So that is about data management. Then we have laws and regulations in place, like the Data Protection Act of 2019, and there are so many. However, the challenge that I should maybe highlight is that they are not so well aligned to digital health, yes, to see how to regulate digital health in particular, aspects of digital health. And then, of course, most of us are not even aware that these regulations exist, yes, and how to work with them. So those are some of the few challenges we have.
I think take us, share more about the regulations. You just mentioned one, Data Protection Act. So I think you should share more about the regulations, especially for the health apps.
Yeah, so I can read to you just a few here.
Okay.
The NITAU Act 2009, Registration of Persons Act 2015, yes. So these ones do not particularly speak to digital health, but for any registration, for instance, of persons or Ugandan citizens, you must know this and how to work around with these acts. Then the Computer Misuse Act 2010, Electronic Transactions Act 2011, Electronic Signatures Act 2011, the National Data Bank Regulations 2015. We have the Registration of Persons Act again, and then the Uganda Communications Commission Act 2013, the Uganda National Council of Science and Technology Act, Uganda National Council of Science and Technology Act, then for research involvements and the research participants, then the Copyright Act, Lulo Communications Development Policy, National Records and Retention Act. So there are very many, the list is endless.
Okay.
Yeah.
So thank you for those. Maybe we'll read them in our free time. So are there any policies that are in place, like for health? Because you were just giving us a general overview of the act. So we want specifically for the health apps.
Yeah, so like I already told you, we still also use this, the already existing regulations. Yeah, but us in the health sector, we also have our own regulations. Like he already told you, like Andrew already told you, we also have our own regulations and policies. Yeah, some are even still being worked on. But at a point of dissemination, when we feel they should be launched and let out to the public, they are always made known to the public. Yeah.
Okay.
But they're there.
Thank you. Just one more question to you, Mr. Gaba. You're the regulators of these apps, so you qualify the apps. Like, for example, you qualified the Mobi Clinic app. So I just want you to take us through the criteria of qualification of an app so that it's out there for the people or for usage.
So the apps, any app that is supposed to operate in the health space should be discussed and approved by the ministry. Yes, so we have structures there. One, I think he should have told you if you had enough time what you went through, but it's not so easy. Only that now when people are developing apps, many times they just concentrate on the functionality of the app. Can my app do this? I want it to do this. But it is important that once you decide to come up with an app, you first do some research and get to know of the other apps in the space doing similar functionality. One, we do not want duplication of efforts. And then we are also recently suffering from a pandemic of apps. There are so many, and almost doing the same, or some even not doing anything, but they are just apps there. So once you come up with an app, you present it. You first reach out to the Ministry of Health, ask to present, and make it known to the Ministry of Health. So once you come to us, there are committees there. For instance, we have the Digital Health Subcommittee, where you present, and these are technical people. They will ask you so many questions, but most importantly, they want to know, is there a need for this app? Do we even need the app? What gap is it trying to address? What problem is it solving? So if there is a problem that it is solving, and it is a real problem, and actually we need the app, and there are no other apps in place that are serving the same purpose, then we really interest ourselves in knowing how to take up the app and how it works. For instance, does it, scalability, issues of scalability, once we want to deploy it, will it work across the nation, or it can serve like one health facility? Issues of scalability, like issues of when we want to integrate with the other apps, the already existing apps in the space. Can we integrate your app with the existing apps, interoperability, all that? Then we also want to know the technologies you use to develop the app, where the data will be stored, yes, how it will be shared and accessed as and when it is needed. Yeah, so those are some of the things we need to know once you're coming up with an app. Then from there, these people, after getting their approval, now they recommend that you go and present to the higher. The higher is the Health Information and Innovation Research Technical Working Group. So it's a big team. You present to them. They help make some recommendations, adjustments, and then it now goes through the other approval stages of the top management after making it through the higher. Yeah.
Thank you so much. So I'll go to Lillian. Lillian from the CSO sector. I just want to get your views on, do you feel that the policy environment is favorable for safeguarding personal or individual data?
Thank you, Joyce. I think on a scale of 1 to 10, we may be at around 7.5 or 8. As you've heard from Mr. Agaba, the Minister of Health, I think, maybe forgot to mention, has developed an e-health policy that was developed in 2016. And I think that is probably what is guiding the development of some of maybe the apps. And of course, in that policy, it does highlight the gaps in the existing security or data protection and privacy laws, or we can just put in general several ICT or digital policy laws. Right now, we have the Data Protection Act that was developed in 2019, and we have a Data Protection Office that is mandated to provide oversight on how data in Uganda is managed and governed, and there's been several calls on to different entities, whether you're, we already know that if you work in the health sector, you have to keep records. But civil society organizations are also encouraged to register with that Data Protection Office. Of course, the office just made, I think, a year, and there are still gaps in how to manage or regulate and provide this kind of oversight over data protection, especially online. Mr. Dembe mentioned something, that the health sector is overregulated, and it should be. because we had Dr. Milo say it would be very inappropriate and very disheartening if your data was released or there was a ransom attack, and your data or your health records are to whom it may concern. In countries, I've not seen this happen in Uganda, and we thank God that perhaps when it comes to security of our health systems, there's protection, but there have been countries that have gone under ransomware attacks, and people's information has been released. We've seen these attacks on other platforms, not necessarily the health sector. Last year, I think there was an attack on Parliament where, emails, sensitive information discussed was released, by some famous, hackers in the world. And we would not really want to see that happening in the health sector. So, like I said, on a scale of 1 to 10, maybe we're around 7.58 because we've not seen these kind of major attacks. So, I think when we are looking at this, we are saying that, the pandemic of the data health, digital health apps is there, and that also provides a problem when it comes to, say, regulating. And I think that we are doing a little bit well, but the other thing that we need to look at, away from that, there's the issue of the digital literacy. And in this case, we can look at maybe putting, for purposes of this conversation, we can look at digital health literacy, the ability for you to use digital platforms to enhance your health, or to have awareness about, the surroundings about your health. And I think that is where the problem is. Coming here, I've heard, of course, about the Mobi Clean app. I've not used it. And I don't know how many of us, I had the director of programs mentioning, quite a number of apps. And some of them were just, they seemed like fresh ones, like they had just been, created in the moment I was here. So there's that issue that, many people still are struggling to get to use digital platforms. We saw, and I'm glad that Dr. Miro, when he came in last, I wish he was here, the people who picked the small phone, the feature phone here, mentioned why they thought it was important. Joyce, you mentioned it was, you felt it was secure, and the reason as to why, our leaders use those small feature phones. They are easily non-traceable. But away from that is many of the people who need the health that we are talking about, who need these services, are people who are yet to connect online. So there is a big issue. There's a big issue that we need to look at, away from us looking at innovation. How can we innovate around us ensuring that my grandmother who has diabetes in the village is able to use, a smart feature phone, all that text, kind of. But again, now that we are here and we are talking to the young people, they have a role to play, and they can act as facilitators when you talk about digital health literacy. They can act as ambassadors, and during introductions, there are people who are counselors, community mobilizers. There are people who picked the microphone saying that this is, it amplifies the voice. And that is why we are here today. How can we enable or create an environment that young people are able to innovate around the current challenges in digital health, but at the same time, innovate while thinking about the security that my other panelists were talking about. We need to talk about things about, security by design. And I think these have been mentioned in passive by, the confidentiality, the security. But nowadays, I think Dr. Miro can agree that when systems, and I'm sure in the health, the e-health policy of Uganda, there's something about having privacy by design, that before something is coming up, you have to first think about the security of the information, the protection of this information. So Sorry, I'm going off topic, but I think some of these things are kind of interrelated, because we cannot just look about us knowing how secure are these systems without us knowing to get to the core where the problem is. Is it just about security that we are talking about? Is it about awareness that we are talking about? Is it us talking about first getting people to understand how to use the platforms themselves, or even just getting people to be digitally active? And the ambassadors are in this room. Thank you.
Okay. So just a follow-on question. So what role, all that you have told us, what role has the CSO played?
Currently in Uganda, when you compare to maybe 10 years ago, in the digital area, CSOs have become active when it comes to advocating for meaningful use of the internet. The organizations that I work with, CIPESA and the Internet Society, I'm no longer the president, but I'm the founder, and currently, I think last week we did announce a whole new team. We do have people who rotate offices, but there's been quite a number of awareness, on when it comes to overall use of internet, and the focus is around policy and getting people to understand literacy. How do we use technology to benefit our day-to-day lives? For us at CIPESA, we do rely on research, because we depend so much on evidence-based research, because if you're going to go into advocacy, and of course you people here at AHAKI would agree that you need evidence, to present to a policy maker or anyone who is involved in policy making. For you to present your case, you need the evidence. So CSOs are doing a lot of pushbacks. We have in 2021, with the COVID pandemic, there was a lot of policing online, especially, COVID, contact tracing and the like. Yes, we did understand there were challenges in that, getting to know who, that kind of, tracing, you infected who and who. But there's been research that has come out that there was a lot of violations when it came to privacy, people using digital platforms, privacy. Personally, I did have COVID, and post-recovery, I received a call from a third party. It wasn't even the Ministry of Health. Someone was asking me, oh yeah, we understood you had COVID. I'm like, yes, where are you calling from? I'm calling on behalf of the Ministry of Health. We are conducting this study. So as a researcher, I really wanted to find out what was happening, why this person was calling me. And in that, they were asking about so much of personal information, and which I felt was a bit of a violation of my, my right as an individual, because this person, the Minister of Health, released information to a third party, which perhaps, in the health centers that we went to for treatment, we should have been told that, we are collecting this data, we are keeping your records, and at any one point, we may come back to find out, as part of this. So there are those challenges, but civil society is doing a lot of work in advocating for responsible use of internet, whether it is in the innovation aspect. We want to see people getting to have connection. There's pushback. You saw, I think you read statistics of the number of young people connecting online. We had about 13 million, users online, but this is mainly in the, easy to reach areas. Away from that, and we go back to the subject here that we are talking about, digital health. And if you further scale it up to, up country, to those small hospitals, how are people able to join, internet or the platform? So yes, in a nutshell, civil society mainly in areas of capacity building, in digital literacy, security, digital security. There's quite a number of organizations that are doing work around that, and mainly focusing on the underrepresented people in the community.
Okay, thank you so much for those insights. So I want to go back to Andrew. Lillian has talked about digital literacy. So for you as an operator, an innovator, and a CEO of a mobile app, how do you think you can create better frameworks to protect your users?
You mean regulatory frameworks? I thought that's his his area. Okay, but I can
But you
contribute.
You
an
can
idea.
contribute.
Okay.
Yes.
Yeah. So I think I'll start at the digital literacy that she was talking about. It's much as we are talking about young people using these tools. Obviously, for Uganda's case, it's a young nation. I think the second youngest after Niger in the whole world. So we are a young population. In Kampala and out, it's youth. So it's good that this conversation is happening. But coming to digital literacy, out of the urban areas, there is, besides the low smartphone penetration, there is also very low digital literacy. So those of us who are in the digital health space, when you go to these areas, on top of training those people, we have digital literacy sessions for them. However, for us at Mobi Clinic, we chose to make our struggle easier, whereby our app is focused for a CHW. So we empower that one person to be able to serve hundreds of other people in the community. So it doesn't necessitate every member in the community to have a smartphone. That is how we went around that challenge, because so unlike other apps that's directly to the user, for us it's about this person, and that, to empower and also empower that person. So that's our approach, which is informed by the challenge of low smartphones and also low digital literacy levels. So we focus on this person at least, and our energies are on putting up their digital literacy levels, digitizing them, then they can serve their communities. So when it comes to the issue of framework, how can we be regulated better? I think much as the ministry has tried, talked about overregulation. Overregulation doesn't necessarily mean regulation effectiveness. Those are two. You can have many laws, but yet they're not addressing to the core. For instance, right now, we have so many laws, but many of them are general laws where these digital players try to fidget to see, okay, I need a NITA certificate, then you go and get that license. Okay, this is what is data, Section 9 of the Data Protection Act talks about, how everyone's health is private and should be respected. So and yet we shouldn't leave out this homework. I think on the regulator side, they also have they have some work to do to inform the public. When these laws are made and policies are made and they stay in the boardroom, and even the process of making them the policies, because for them as a ministry, they can make regulations and policies, but when they are made in the boardrooms and we don't get to know, so I think there is still a gap in creating a bridge between the regulators and the people who are coming up with this app. So, and much as there are the committees, and not all innovators are going to manage to circumvent the bureaucracy sometime that is interfaced while getting these clearances. So I think, given that the Ugandan space is youthful and people are innovators, I think the ministry, good enough that the gentleman Agawa is here, should really try to create that network, that bridge, such that people find it much easier, and they can even see the direct policy that is really the one that guides them. Yeah, thank you.
Thank you so much, Andrew. Do you have anything to add, Mr. Agaba?
Yeah, thank you, Andrew. About digital literacy, I will first start there. Much as the youth are a big population, or proportion of the population here in Uganda, access to education, yes, and trainings is not there for everyone. Up to today, there are institutions, even in the health sector, yes, the health institutions that have not yet thought that it is important for people to learn and access information about digital health. Yes, they are still thinking about the rudimentary and old HMI system, paper-based tools and all that. And you find someone has successfully gone through that formal health training through the health institutions, but they cannot comfortably interact with a computer or a computing device. So those could be some of the challenges. Then about the framework, I think I should have even put a disclaimer as I started. Usually when we come for such interactions and discussions, somehow you realize that I'm somehow reserved because we do not know today who we discuss with and what their intentions are. But yeah, but I make sure that at least I try to give you the detail that I can and what you should know. Yeah, so about the frameworks, really, you see, when it comes to frameworks and policies, they are there. The regulatory frameworks are there, but they are not biting enough, like he's saying. And most importantly for us now at the Ministry of Health, we are trying to develop mechanisms of strengthening these already existing regulatory frameworks and the policies and laws instead of coming up with more. Yes, yet the already existing ones, people do not know about them. They are not being used. People are not following them. There is no awareness.
Yeah.
Yes, so people need to first know these existing ones, and we make use of them before we think of coming up with even more. Yeah, thank you.
I know our time is up, but do you as a ministry have any plans of letting people know? Because now if you shelve them, are they of use? Like those ones that you said that...
I said these are meant for the public, yes? They are meant for public consumption because they are supposed to regulate the use of health data in the public space. Yeah, so whenever they are developed, there are always dissemination workshops and all these and publications, they are always out for the public.
Okay. So thank you very much. But as we finalize, Alima, I just want each of the panelists to make a last statement to the youth, since this is a youth-led activity about digital health and what they should embrace, a take-home for the youth regarding digital health.
Okay, thank you. I think most importantly is for digital health, there are so many things in the space, but some things I did not talk about, even ourselves at the ministry and the health workers in the whole entire structure up to the community level, we are trying to make sure that we put trainings, for instance, for the health workers, there is what we call BUHIC, Build Uganda Health Informatics Capacity. We go out to train the health workers on how to use these systems. There are apps, there are EMRs, there are databases, there are dashboards, how to access, use, and interact with them. For instance, with COVID, we try to make sure the point of care is functional, where at each service delivery point, someone can access a computer, be it a nurse, a lab technician, and handle a patient without having to write anywhere or, just using the digital provisions there. And then we also try to empower the health facilities with, for instance, teleconferencing equipment. With this COVID situation, we had a lot of Zoom meetings, virtual meetings, CMEs, all those trainings, so that the health workers can really proceed to access information and carry on with their meetings and discussions without being affected by the restrictions of COVID. So as the youth, you need to know the available digital health technologies. We have platforms that you need to visit regularly, the e-health library, the knowledge management portal, the digital health and visualization tools dashboards, where all the approved and recommended dashboards and systems are displayed for you to access, so that in case you're planning to come up with an innovation, you first access and see what is there and how maybe you can enrich the already existing without struggling and duplicating efforts. Yeah, so you need to really interest yourself in knowing some of these things, and you know how they work. That will help you so much. And also taking into consideration understanding the paper-based HMI systems, because usually it's what you base on to digitize. Yeah, thank you.
Thank you so much. Lillian, just 1 minute. Thank you.
Thank you. To me, I'll start by encouraging or urging the youth to, first of all, embrace technology. When you embrace technology, you get to know how technology works. Technology, whether it's digital or analog, is where the future right now is digital. And with the statistics, everyone here I see has a smartphone. You are ambassadors when it comes to engaging with communities. Whether it's your families, when it comes to digital health literacy, this should be on your agenda. And by the virtue of the fact that you're here, you are interested in digital health. You're interested in health. So get to know how technology works. Get to know how digital health works. Work with solutions. Get involved in in several spaces. The Internet Society, for instance, I'm an ambassador. Get to know how the internet works. What are the opportunities? If we are talking about developing digital solutions, to solve, everyday problems, how is this possible? We saw people using, cables, power backup, and all that. Most of the places that these solutions are meant to, solve problems do not even have electricity. So you, as a young person, what are you doing about that? What role do you want to play in ensuring that we stay connected? So my humble appeal is for the young people, get involved in technology, get to know how it works, and with that, health is one aspect of our lives. Without it, we cannot do anything, but also understanding and, getting to spaces like these ones, like the Internet Society. There you get exposed to different aspects of, of technology and society.
Thank you. Have a second.
All right. So mine is really to encourage fellow youth to be always up for learning. Like to appreciate all of you for being here. That starts with those efforts and identifying our healthcare problems. When you identify what parts of the problem are being solved, like Agaba said, that do some benchmarking, find out who's doing what, and some of that is through such forums. And then if you want to innovate something, you see the particular part of the problem that is left unaddressed, and then you also contribute like that. I so much believe we can all create an ecosystem that serves us all, and with favorable policies from our regulators, we can make our country a model country for digital health. So that's it. Thank you.
First, I want to thank you for having your ears. Yeah, and I want to convey my recommendations to you. First, of course, you should embrace technology, and you should be involved in the design of the technology, not just embracing it. You should be innovative and design these tools. But as we design, whichever tools we're designing, if you're designing for health, then just know that your design is going to face the same scrutiny as any other health service would face. So that means you have to, if you're creating a team, you have to co-opt in healthcare providers. You have to co-opt in healthcare professionals to give you mileage in that regard. For instance, a healthcare practice is regulated or is guided by 4 principles, ethical principles. And there is a principle of autonomy. This also applies to the data that you would have. So the person you're collecting data from retains autonomy of that data. As she mentioned, that you're supposed to know what's going to happen to that data. So there is autonomy, there is beneficence on data. That means whichever data you collect, you have to be intentional on using it to give maximum benefit to the person you're collecting this data from. Then the other principle is non-maleficence, of course. You're not supposed to do harm using the data you're collecting from patients. And then lastly, you're supposed to keep utmost confidentiality for this data. So as you're designing, you have to look at all these ethical principles that they are actually catered for in whichever tool you're designing to help the population. I want to, of course, these different principles have limitations. Not limitations per se, but they are exceptions. For instance, in research, there are exceptions but this happens after signing, of course, a consent form on how much your data can be used and who is supposed to use your data, which is also stated. Still, this maintains the principle of autonomy. But then, at some point, as you mentioned, that people called me that you had COVID or you had this or that. So there are certain instances where some principles don't apply. Yes, there are cases where they don't apply. For instance, in the interest of public health, if there is an Ebola case here in this room, definitely we shall know about it, all of us. And they will also know that we are all in contact with an Ebola patient. This is not in a way of disregarding your privacy, but it's actually to protect public good, to protect everyone else you may come into contact with. So in such a scenario, the principle of autonomy, the principle of confidentiality, they don't really apply in that regard. Same thing applies when, let's say, someone raped a child and maybe this person was HIV positive. Yes, chances are high that this person is HIV status is going to be pronounced publicly. Because this is a matter, this is a law issue, this is enforcement, and yes, this is going to be talked about even in litigation in the courts of law. So such cases, certain instances, the laws of confidentiality are broken. But all in all, I want to give you confidence that these tech solutions are developed with teams that have healthcare workers on them, most of them. I think almost all of them. And at least healthcare workers know what to do with people's personal information. They have, not just in the digital age, but they have been doing this for centuries. They have been doing this for thousands of years. They have known this, that for you to access someone's health data, you have to apply certain principles to it. And these principles are being applied in the day-to-day apps that are being developed and utilized publicly. And I want to, of course, I want you to trust the different apps that people have developed. I want you to trust them, because if you feed them with good information, that information will be very useful to you and to the public good. Thank you very much.
Thank you so much, the panelists.
He wants to say something small.
Yeah, thank you very much. As she concluded, I had her trying to focus on innovation. So for some of the youth or the youth that are intending to develop, come up with innovations, it is key two things. You consider it being client-centered. Yes, the client is king in all this. If whatever innovation you're coming up with is not helping the client, then it's not good in the health space. 2, health system efficiency. If whatever innovation you're coming up with is going to cause more harm than good in the health space, then it's not desirable, it's not good. So for instance, you're coming up with a technology and then people have been having a turnaround time of 5 minutes for a say COVID test, and now they have to take 10 minutes and wait longer, things like that. So those are 2 important things you need to consider. Thank you.
Thank you very much. So I know we have a lot of questions. I'm going to request that you keep those questions safe wherever they are, and then we take a health break. I'm sure something somewhere is demanding, like we need to refresh ourselves a bit, and then we come up. So we need to be in this room at 11:30. I don't know how we are going to do it, but by 11:30 we should be back in this room. So Aksam, do you want to lead the people? There is a room that is prepared where you're going to have the health break from. But in the event that it is 11:30 and you're not done, kindly carry your tea and get back to this room. Do I have to say this again? All right. So, okay.
It means Afia is health, Haki justice. Health and justice, yes.
When did you
So, welcome back from the health break. I will request the panelists to please come and take your seats again, because the youth are very eager. They have a lot of questions that they are going to be asking you. So, please take your seats again. And then you need to be careful about some of these bottles that you're seeing down. We shall use them after this session. Please, Lillian, take your seat again. So this is the time that Joyce will be inviting any follow-up questions from any of the speakers, and you can direct your questions to the person that you would want to attend or address the question that you will be asking. So Joyce, you can use this one.
Any questions? Yes, please.
Thank you so much. Thank you for the wonderful presentations, dear speakers. Well, I'd like to direct my question to, it's only one question, but maybe I would like to hear from the CEO of Mobi Health and the doctor. Well, in communities, we have a challenge more so to do with misconceptions. Sharing information which is confidential, usually, and on digital platforms can be quite hard for people in the community. Well, I'll give an example of some people I know who cannot pay anything using their credit cards online because they believe maybe this would dry their accounts up at the end of the day. So how are you convincing the communities to be sure of the protection of the information that they are sharing on these apps that we are trying to promote? And maybe how do you think you can work with us, the young people who are in here, to popularize this information in the communities? Thank you.
Thank you so much. I think we'll take like 5.
Thank you very much. I think mine is going to be more general. I've heard of this and it's really very vital. I come from Gulu, but these things are not really popular there. I don't know, what plans do you have to make it more engaged for us in the up country, and how can it be really helpful? Because I know technology is a bit a problem there, but how can we be involved in all this? Thank you.
Thank you. The question was directed to the CEO. It's a general question.
Thank you very much. I realized that 80% of the panelists are service providers. And then, so on the CSO side, we usually do the advocacy, if I'm not wrong. So are you basically service providers, so we should just partner with you? Do you also do that bit of providing the information, or you wait for the sick and then you heal those ones? Okay, to clarify it, is that you're basically service providers. So because with CSO, we do the basic, the whole community. So do you wait for the sick and work on those? Do you, from the large population, draw out, how do you best look for your population? Or what is your target population? Because you said that those that use the app most were the HIV clients.
To everyone.
Thank you so much, our panelists. You have shared insightful issues, and I think I'm not the same on digital health issues the way I came in the morning. I have a few questions or areas that require some clarification. For Miro and Dr. Miro and the gentleman, sorry, I don't remember the name, Moby Clinic, from Moby Clinic. I picked Moby Clinic because I found it very interesting. Where do you store the apps? Because I know there is Google, there is what? Who owns that app? And then who owns that information? Because when I have an app, say on Google will be taking over my information. Do we have any safeguards? And when we have that information on the app, where do we store that information? Is it on a cloud? Is it where? So who owns and who can be held accountable in case there are any breaches of data security and related issues? So I would like to get your guidance on that. And if we have any platforms where we can host our apps in Uganda that are secure and we feel that they are based in Uganda, such that we don't see any migration of our data from Uganda across other continents. There was an app where the app was serving Ugandans, but the information was in Germany. So the German government or German entity was managing our data here, and we didn't know. So it might be important for us to know. Two, we have quite a number of items that we had put in the morning here. I saw smart watches. We have smartphones. Who is in charge of our information? For instance, on a smartwatch, the smartwatch and the phone are connected. They get your heartbeat, you run, they know how to manage you. They say, now slow down, now this is how you performed this week. So who is responsible for my data, especially if I use a smartphone? So for you as experts, maybe you need to advise us on how we can be more conscious and get to know who can we go to in case we have challenges. Then for Mr. Agaba, thank you so much for the initiatives at the Ministry of Health. And I agree with you that we need to ensure that the public is literate on digital health issues. And I think Chipesa will advise us later on how they have done it to ensure that some percentages of people in the public know about digital health. But I'm wondering, in case there is digital breach or security, are there mechanisms where a user can go and complain outside the court systems and the rest of the avenues, but as the ministry, are there mechanisms? For instance, if I read the Patient Rights and Responsibilities Charter, if I have a concern in a healthcare setting, which is a physical setting where I work in a facility, I can go to the in-charge and complain. I can then walk to maybe the chair of that institution. There's an institutional committee which helps to manage and regulate the services at that particular center. I can go and complain, or even DHO's office and the rest. So for digital health apps, for instance, if I have a challenge with Moby Clinic, where do I go to complain? And I get redress. Lastly, sorry for having so many questions. The conversation was very interesting for me. Lastly, for the Moby Clinic people who have an app, where do you secure licenses? Anybody talked about license from NITA? How many licenses are you supposed to get? And are they annual, or it is a once-off? When I get my license, I operate my app until I die or until the world closes. And lastly, for Miro, who has done a lot of research, are there guiding principles you follow as you develop apps? Apart from the general ethical standards and principles, are there standards, acceptable principles that you're supposed to follow as you develop apps? So I'd like to get your clarity on that. Thank you.
Thank you so much. I think we can respond to this first. Then we get the next set of questions.
Thank you so much. So the first question was asking about she deliberated on sharing confidential information and then misconceptions rather here in the community. And then I think the question was how to ensure confidentiality. and how to ensure public confidence in the digital apps that we have. So to do this, how to ensure this, first of all, I want to state this, that much as this is a technological innovation, it's just health services being pulled out of papers, out of offices, and put on a phone. It still remains health services, and the same guiding principles apply. So the same trust you would have going to a hospital should be the same trust you have if you're accessing services through your smartphone. Yes, because most of the service providers have doctors on these teams, and these doctors are liable to breaches that are supposed to happen. So I hope that answers the first question, the confidentiality. It's the same trust you have. If you don't have trust in the healthcare system, chances are you're not going to have trust in the digital health system as well. Yes, because I want to state this, that the system, it's just a means that change. It's the means that change. The means of delivering the service change, but the same service remains. And the same guiding principles still apply. Yes, so I guess it also, I'll try to also answer the question on who is liable to breaches in the data. Yes, and here I will say this, depends on at the point where the data loss or data negligence happens. Yes, and this is a very gray area. Even regulators don't have sufficient information on how to go about it. But there is data lost or, I don't know, misappropriated at the source of the data, and this is by a healthcare provider. So whoever is collecting this data, for that any discrepancies, they are liable to the loss or to the breach of data that may happen at that stage. Then we have data that could happen, rather data loss or data leakage that could happen when data is stored in the different databases that are managed by the service provider. For instance, MobiClinic. So let's say MobiClinic's systems are hacked. Now MobiClinic is liable to the leakage that would happen at that stage. So different players in the ecosystem take different liabilities depending on the responsibilities they have in the system. So another question was about, someone asked, how do you identify your population to serve a digital health tool? That was the third question. So how do you don't identify a population, you identify a need in the community. For instance, also it depends on what you do. National Drug Authority discovered that there were issues with pharmacovigilance. Pharmacovigilance is being alert about side effects and reporting them. So when they discovered that, like, for us we can do an innovation in that regard. So they innovated they innovated a tool that could guarantee easy reporting of side effects of the different drugs. So that's the space that they innovated in. So another person would notice issues in, let's say, adherence to HIV medications. And maybe that person may come up with an app for HIV patients to guide them on adherence. So really, the need dictates the population that you're going to serve. If you identify that I need to serve children, that's going to dictate. Rather, kids have certain needs that I need to serve, that means the kids are going to be your target population. If you find out that maybe the elderly have a lot of diabetes and I need to innovate in that line, then chances are high that the elderly are going to be your target population. So that need really dictates where innovation is going to take course. So someone else who is in charge of the information collected by smartphones, let's say when they measure your pulse rate, your blood pressure. So really this also, I'll say, is a gray area. If you're subscribed to a health service provider, definitely the health service provider is in charge of that data that you collect. For instance, Mobile Clinic, if you're using services from Mobile Clinic will be in charge of that data. Then we have this data, all other apps from outside countries that are collecting similar data, health data here and there. Of course, they ask you to read policies and guidelines before you actually sign up for what? For these particular apps. These are binding policies that you have to read. And that states who owns your data. The service provider, whether it's Apple asks you that, hey, we want to provide you with this and this. Yeah, you read through and see if actually it's something you would sign up for. If you don't sign up for it, that means you don't agree with their policies on data ownership or whichever other reason could be there. But actually, most times we don't read these. I think most of you don't read these. And that's a challenge that is there. I don't know if they have to be revised and be simplified and made a bit tenable by the people who are trying to read them. Maybe that would solve that issue, because many people just sign up as long as they just agree to the terms and conditions without actually knowing which terms and conditions they're agreeing to. So there it comes back to bite you, the individual who agreed to certain terms and conditions without actually going ahead to read them. Thank you so much. I guess I took some of the questions, and the rest of my colleagues can answer the rest of the questions. Yeah. For someone who said about Gulu extending services to the rural areas, there are many partners, many players in the tech ecosystem, and they are trying their best to extend these services. I know of AMREF, I know of Vision Fund, I know of Living Goods. Yeah, they are trying to extend, especially to the rural, hard-to-reach areas, but of course it's a process. Thank you.
Thank you. I'm going to try to respond to the questions that were directed to me, but I would like to add on what Dr. Miro just mentioned, that quite often many of us do not read the terms, the T&Cs, the terms and conditions, when we are getting to use these platforms. So we only begin to complain when things have gone south. Yet it's important we look at this platform and the T&Cs. So I think, again, this is an appeal to the regulators that part of what they would do is to make sure that the innovators write for the intended user simplified T&Cs. Because if then the innovator is being shoddy, can put very complicated, also the terms and conditions are drafted by lawyers. And we all know here how sometimes lawyers can want to be very complicated and use very big terms. Myself, I'm a lawyer, but I sometimes I'm so overwhelmed by the terms they want to use to communicate simple things, So it's so important that we work with the regulators to make the work easy for our people when they are onboarding our platforms. I want to start with the first question, which was convincing the communities. I think the gentleman asked it, and how you can work with us to popularize. I think our first inroad in the community are the VHTs, and these often have the trust of their immediate neighborhoods and community members. So there is where we are starting. We leverage that trust that they already have in their communities, so they can convince their colleagues further. And then when you go in these communities, people are already aware of their big challenge, so they are really receptive when you're coming to work along with them to solve a problem. I think that's why government also gives space to the private sector to partner with them. Just 2 weeks ago, we had the meeting of different partners in digital health in Buyikwe, Living Goods, and all others that you've spoken about, and Mobile Clinic. So I think even government recognizes that it may not be everywhere, and that's why also us in the private sector are there to work with them. So our inroad is the VHTs, and that's what we've been using so far to convince the people once we've extended to a particular area. But we are also open to discussions depending on where the place really is. And the lady asked about how to popularize the tool to Gulu. So far, Gulu is not really in our scope. And I'm going to mention that also in the stage of development of these tools, I'm not a software developer, but I've worked with them for about 4 years, and now I know part of their language. there are certain levels like 0.1, 0.2 till like they have the app version 1.0, you know, because we've been in Buyekwe, but even us, if you ask me, we are still, we take it that we are still even piloting our tool. That there are certain learnings we get and improve how the tool is working. So part of the things of scalability, like Agaba had mentioned, is seeing can it be scalable elsewhere. So those are things you will also be able to make informed decisions about once maybe you've piloted and you're seeing that this is not working here, you need to improve this so that it's scalable in such a manner. So for Gulu, that's why I'm saying, so far our storage capacity, whatever, the infrastructure we have at the moment, we are really dealing with the Eastern and a bit of Central. And then what service do we do? Whether we only do treatment, really the core roles for us, all we do actually is build a tool that we give to the service providers, your very VHTs, your CHWs, to offer, to simplify their service delivery. So that's why you see, somebody asked a question about liability, the gentleman, that there are different levels of liability. For us, the liability of service is to that immediate service provider. If it was your VHT, that's the one that is the one that's liable. For Mobi Clinic is only liable for the data. So anything to deal with data, Mobi Clinic is liable as an entity because it has a duty and a mandate to keep your data safe. Storage. There was a question about storage. Where is this data stored? So far what we're doing, we've had part of the data here locally, but much of our data is on AWS. And you will agree with me that for much of our tools that we use here, Uganda does not yet have infrastructure of, permit me if I'm wrong, I might be corrected, does not have infrastructure really to store the huge amounts of data. So you find that the servers are out of the country, and okay, correct me. It's but what I know on the surface level is that we are yet picking up on infrastructure, because even Google that we use, I don't think Google is best here. It's not. So even WhatsApp, that WhatsApp storage, I think it's all those media that you have on your WhatsApp. If I'm to use WhatsApp, it's not stored here in Uganda. So quite often we are using Google services, and really Google is not in our jurisdiction. That our information is out there, and even for health, some of the health platforms, you're directly liable for people's data, but you may be storing it out of jurisdiction, some of it. So that is it. Yeah, so again on that one, I would like to know more on the local hosts, if they're there. So a gentleman asked about the watches, I think, yeah, smartwatch. The smartwatch. So for some of these products, like you see, they are international products. The company is incorporated elsewhere, but you're being a client and you're in Uganda. When you read some of those terms and conditions, they tell you where you have to lodge a complaint. They can tell you that for them, anything, if you have a dispute, you'll have to settle it in their country. But like I said, quite often we don't take on these. So where do you complain if you didn't read? There is always something called voluntary assumption of risk, that for you gave your consent, and you didn't look into the detail, but you gave your consent. And also, perhaps you saw whatever is there and you're like, I'm fine with it. Because I want to imagine that also with data, the main thing is your consent. That's why they tell you Section 9 of the Data Protection and Privacy Act talks about how your data should be respected. So if they have told you how they're going to use your data, or even where they're going to keep it, I mean, once you give them that consent, if anything goes wrong with your smartwatch, I don't think there is anywhere here in Uganda where you can really start to issue a complaint. So that's really it. But I would like also to comment on cybersecurity. I realized that even for digital apps, much as the world is becoming technologized, there is another need that now threats shift from being physical to digital. So even cybersecurity is a key thing. And I think that's where there are people who are called white hackers, that somebody is paid to say, I've built this, break it. And once they break, the more they break, you get to realize, there is a window here, close it, like that, till a product is really firm for the market that you've intended it for. I think, let me answer those. I'm sure the rest will address the rest of the questions. Thank you.
I don't know what is left to address, but my focus will be on the issue of data health management or digital health management, and that falls under a bigger term, data governance. So issues of ownership, stewardship, where does this fall? I was just trying to pull out something. I don't know if you've heard about the general data protection regulations that were developed in 2018 by the EU, and these kind of govern. They more or less, the EU came up with this kind of, regulations, and it was looking at companies owning data and manipulating data and, kind of violating individuals' rights. This became a mandate for every country that does anything to do with EU citizens. This implied that the apps, if you have anything on your phone and you're going to, maybe it is owned by someone in the EU, that is, EU is the European Union, then you had to be able to see how you're going to apply with these regulations. How does this affect the rest of the world was that many countries had to either adopt new laws that were in compliance with these regulations, the GDPR. This was 2018. And during that time, Mr. Agaba mentioned the Data Protection Act of 2019. Uganda had already started drafting the data protection law in 2014. And everything had to come to a standstill until the passing of these GDPR regulations. And currently, if you take time, and this is where we are, that we are saying that you need to have an interest in how technology works, whether from the regulatory perspective, or whether from the user perspective. On the regulatory perspective, if you're a user of digital platforms, it is your responsibility to know how your data is used. Because today, if someone used your data for God knows what, you have the right to go and demand through the Data Protection Office to report. And there's quite a lot that is happening in Uganda. We have the cyber crimes unit within the police, CID, and the like. So the Data Protection Act has a specific, I'm not going into the details of it, but there's a specific article that points to the GDPR. So in terms of that, if you're having your smartwatch and that, there's the issue of ownership, stewardship, the data is moving across the globe. Today we are speaking here, we are broadcasting on YouTube, okay? Someone else is watching and we don't know who is watching. They are recording and they're going to use this data. So there is that aspect that right now, even if you're using WhatsApp that is run by Meta and Google that is run by, Facebook that is run by Meta still, or even Google, which does most of the hosting services for most of the apps, and even Apple, for those who have, the Apple Store and all that, you should be protected by the regulation here in Uganda, and because of the GDPR. But what we have seen that in most cases, Uganda, we are lucky enough to have this particular regulation on data protection, which is not the same for other African countries. So there are some countries that are still struggling to come up with data protection laws. However, now we're also seeing there's a current push for data localization, where countries are saying that if you're going to do anything digital, your data has to be stored within the country because of the jurisdiction issues. That, we may say it's a good thing and a bad thing at the same time. It's a good thing because now it is easy to track where, there are violators of, this right to, privacy. However, it may be a bad thing because of the challenges we have. Just imagine if we had a data center, running maybe we have a specialized platform, that is run by the, Ugandan government or, a private sector, or it's a joint partnership that this is the email app that we are using in Uganda, and we know we have a data center somewhere. And kaboom, power goes off, We still have these challenges in terms of, technical capacity, who is going to run and, do this. So there's the conversation on data localization. But to answer the question to the gentleman who asked about that, there's that challenge, but I believe that the data protection law does provide, has mandate to be able to give us some sort of protection when it comes to data sharing between several apps and where the data is currently hosted and managed. Of course, there are still challenges. The Data Protection Office, like I said, was just established not long ago. They celebrated, I think, a year last year. And there are still challenges, and that is why we call upon everyone to just be knowledgeable. When it comes to privacy and security, it begins with you. We shouldn't look at government. We shouldn't look at the service providers. We shouldn't look at, maybe academia need to come up with research and see why is the problem. Your security, your personal security starts with you. And once you know that you've secured your information, you've put in place measures to secure in terms of, if it's personal data, you have, everyone I'm sure has a password to their phone, you do not share it. The same practice starts with you, and then you can become the ambassador in sharing that information. On the issue of data centers, I'll just sit on it. I think we have data centers in Uganda, but maybe they are not strong enough to do all the hosting here. But I'll let Mr. Agawa point more light onto that.
Yeah, thank you very much. I know I may not respond in that same order that you asked, but first with the lady from Gulu. The rollout and deployment of these solutions, one, before they are rolled out, I don't know if I earlier mentioned it, but we do pilot tests and the rest. We pilot them before we finally roll them out. So for instance, like most of the community interventions that are being discussed here are very, very active and rolled out in areas of Lamo and in Ntungamo in Uganda. Not even here in Kampala or any other cities. So you find that those people there, the VHT, actually all the VHTs there have smartphones, they have solar systems to charge their smartphones, they have been taught how to deal with the smartphones, much as some of them are too old to use smartphones. There are site challenges, they cannot read and write, but they are there. So eventually, once these solutions seem to work, they are rolled out to the rest of the country. That is how they do it. So I think that is answered. Then information storage. Information storage, any information in the space that is to do with personal identifiable data is supposed to be stored or hosted under the Ministry of Health. Yes, or by the Ministry of Health. Like I told you, some of these systems are being piloted. So at that point, the Ministry of Health, so these approval stages, they just allow your solution, yes, to start being used, for instance, for a pilot test. But for the other stages, after all that, we look at transitioning these systems to the Ministry of Health. Because we do not want issues of, if you so much remember, the people who played football when we were still young, you reach a point and the captain or the owner of the ball wants to take their ball. Yes, so to avoid such things and many other issues, at some point, if you're developing this solution and it is for the health sector, you should be considering transitioning it to the Ministry of Health. Yes, because it is meant to help in that direction. I know if Andrew knows about that. So you should be able to transition it to the Ministry of Health so that it takes full control and responsibility of the utilization and engagements of the system. Then again, to say that the government has no infrastructure to store or these solutions, it is not true. Because at the Ministry of Health, we have, I don't want to say enough infrastructure, but you see, we work jointly with NITAU, Ministry of ICT, and those facilities are there. Yeah, so when you take the and do due diligence, you always get this information and you'll be helped on how to host your solutions there. Then data for smartwatches and these other applications, Andrew explained that so well. Sometimes we share our information without knowing how it will be used and who will use it. Disclaimer that sometimes we need to be reserved about some issues. Because now today I'm here, and before you know, someone will be quoting and saying the Minister of Health said this. Yet it is Agaba who was saying. Yes? Then reporting, which was asked by someone there, if they face challenges while using these solutions, applications, who do they report to and how do they report? So the Ministry of Health has very functional structures and a fully fledged department to handle that. It's called SCAP-D. Yes, Standards, Compliance, Accreditation, and Patient Protection Department. So it's there. So you can always get back to these people. And then we also have channeling on or transmitting this information to the Ministry of Health. We have a call center, we have helplines, we have social media channels, and then at the very, very worst, you can take it back to the public court, Twitter, social media, and the rest. But really, I know there is enough opportunity for you to pass on feedback and report anything wrong that is going on with your data. I think that is it for now.
Okay. Dr. Miro needs to add on something.
Some questions weren't touched. For instance, where do we secure licenses? So first of all, anything to do with data, in Uganda, it's NITA Uganda. So that's the first place where you go to get a license. And then the rest depends on which services you're going to be offering. So if you're going to trade in drugs, that means you're going to have to secure a license from the National Drug Authority. If you're going to offer health services at a level of a doctor, then that means you're going to need clearance from the Uganda Medical and Dental Practitioners Council. So depending on which service you're trying to offer, there will always be an MDA that is responsible for that, and that's the MDA that you should reach out to. Then, are there guiding principles for developing apps? Not really. First of all, innovators are always ahead of regulations, and regulations just catch up with time when innovation is already in place. So here, in this case, what really guides the principles that are guiding an innovator in development is, as I said earlier, is need, demand. Yes, that's what guides you. And then after you've identified your niche, then you can reach out to regulators. Of course, there are issues of intellectual property rights. People develop these innovations with different motivations and different goals. And some are trying to profiteer from them, others are trying to create social impact. So they ought to reserve a certain degree of autonomy over the affairs of what they have developed. That's why I disagree with the ministry's proposition of transferring these digital health technologies to the ministry, and I think it may not be applicable. So because it won't really motivate innovators to come up with these innovations. So what guides you is the need. In the beginning, it's the need, and then later it's the service you're offering and the regulators that are responsible for that service. Thank you so much.
Okay. Thank you very much. I don't know, Fatina, whether we have any questions online that they can address, but as they come, we shall still require them to take on. So from the discussions and everything that has been mentioned, one thing we can know that it has been emphasized that denying people access to health slows down development in a country, just like Dembe mentioned, and it is for this reason that they actually developed apps to make sure that even the lowest people can be able to connect with the first line as well, the VHTs, and then they connect them to the health practitioners. And the other thing that probably I can pick on was why they chose the community health workers was they noticed that they hadn't been trained for over 20 years. So they engaged to be able to be the first contact to these people at the grassroots. And the other thing I picked out from Dr. Miro was that we shouldn't be worried. All the healthcare providers, they know that data protection is a virtue, is really vital by nature of their practice. They know that issues of confidentiality and data protection when it comes to health information for their clients, who are the patients, is very key. And we should encourage people to actually interface with this because their data is really protected. And if I go to Lillian, in terms of digital literacy, we need to create awareness because we are not sure that everybody down there understands digital systems, health apps, and all that. So I had Mr. Agaba talk about awareness. I know Ministry of Health normally does those campaigns where they take outreaches and then they try to engage the community in trying to understand the innovations that are in place. But then also the system developers, they need to know, because I heard him emphasize that most of the health apps developers, they are most interested in the functionality of the apps. But now to the users, who is going to actually sensitize these users about the dangers of some of these apps? So I think that's where the ministry comes in, and they have mentioned all those regulatory frameworks that support in that area. And the other thing that I will probably point on that I could be like take on for us is that healthcare can actually be transformed when these systems that we are talking about are able to present the data that is right, and it's presented to the right individuals, and then it's also provided at the right time, and it's also provided in a meaningful way. So these are things that we should keep on thinking about. So before we engage the youth in their group to tell us about their experiences and then their challenges, I'll request that we just stand up for a small energizer, just to get us to the next session. And at this point in time, thank you very much, Mr. Agaba. Thank you very much, Mr. Andrew. Thank you, Ms. Lillian. And thank you, Dr. Miro, for having accepted to take on the questions from the youth. You are also going to be participating. So you need to be in a pair. Yeah. You stand in front of a bottle. There must be a bottle in front of you, and then you're paired up. Okay, I can demonstrate. So, assuming this is a pair, so you stand here, and then your colleague stands there. Then the next pair is here. The next one, just stand where there is a bottle. Yeah, you must face each other. And are you scared of coming close to the bottles? Let's go close to the bottles. Make sure that you're in a pair, and then there is a bottle. There is a bottle before you. We can close up this space. There is a bottle here. Everybody has a bottle in there. Do you have a bottle? Okay, everyone is looking at a bottle. Okay, do you remember that school we used to sing, that song we used to sing in nursery, those who went to nursery school? Head, shoulders, knees and toes, knees and toes, knees and toes. So that's what we are going to sing, and we are going to be really loud to show that we are energized. The youth, you need to show us that you're really youthful. So we need to hear you, and I'm going to call on someone to find out if they can really hear you sing loud. Can we start? Head, shoulders, knees and toes, knees and toes, knees and toes. You don't need to do actions. I need you to sing. Yes. Yes. Who knows how to? You sing. Can we sing? So, but now we are going to use bottles. So when I say, we are going to say head, shoulders, knees and toes, knees and toes. Then after we say head, shoulders, knees and bottle. So the person who grabs the bottle is the winner. Are you ready? Are you very ready? Okay. Head, shoulders, knees and toes, knees and toes, knees and toes. Head, shoulders, knees and toes. Uh-huh. I didn't say the bottle. So if you know that you touched the bottle, you take your seat. If you touched the bottle, please take your seat. You are out of this. So if you touched a bottle, you move. And then we remain with those that can follow instructions. So, Mary, do you want to come and pair up here? No, just come and pair up with someone. Go and pair up with make sure that you're paired up. Everybody has a pair. So we start. You must only hear the word bottle, then you touch the bottle. Head, shoulders, knees and toes, knees and toes, knees and toes. Head, shoulders, knees and bottle. All right. Okay. Thank you very much for that. I hope you're energized. So now we are going into a panel for the youth. And Aksam, how are you going to, do you want to have your youth here or? I wanted them to be here, to be on the mat.
Sure, then the moderator.
You can. Okay. You're going to call them in front or when I come in?
They have.
Okay.
And then Jesse is going to fully moderate.
Joyce, what about
Jesse.
you? Okay. Jesse, you're moderating the session? Okay. So Aksam is going to lead us in this session of the youth, and yeah, you're welcome.
Yes, thank you very much, Alima, for taking us through that session. I'm really excited with the discussions that are going on. And during the previous sessions, we've had experts to say what their views are and experiences about digital health. And now we want to listen to the participants. And this is the target audience, who are the youth. And in this session, we are going to be sharing experiences, the challenges, and what they think must be done to see that digital health is fully felt among the youth, and also utilizing all these resources that are always available for the betterment of our health. So I take the privilege and honor to say that Jesse will take us through this session. We want it to be so interactive, and according to the setup, we thought it wise that since it is a focus group discussion, the panelists will sit on that mat round, and of course the moderator of the panel will be sharing, will be like the father for this conversation. So right about now, I want to call upon Nkobe Fata from Sehad. You're most welcome. And the second panelist will be Florence Nabukenya from Public Health Ambassadors Uganda. Then we shall also have Nabatanda Gloria from Smart Youth Network. Then we shall also have Chiganda William from Community Health Advocates Association of Wakiso. And please feel at home. I don't know why the gents are on one side, at least there should be. And yeah, and Jesse will actually push the chair in front a little bit, and please. So this session is going to be short due to time, and we are specifically going to take 15 minutes for this session.
Before the focus group discussion starts, we would like to acknowledge the University of Warwick. We are collaborating with them on this project or the program that we are running. So, the University of Warwick, thank you.
Yes. Thank you so much, Alima. Jesse, please.
Okay, thank you so much, Aksam. Well, we've heard from the experts. And now we're having a youthful panel. Right now what we're going to do is just share experiences as the consumers of the digital health that we've been talking about. Okay? As the consumers, I would like to hear from each and every one of you. At least take 3 minutes of your time to share with us as a young person. What do you think? What is your experience in using digital health in the digital health approach that we are trying to take? And also share with us some of the challenges that you have faced in using digital health, and also just use 3 minutes for that. Yeah, thank you so much. We start from you.
Thank you. Maybe on a clarification, can I share my experience when I am offering services as a digital person, or I have used the digital platforms myself? Just can you, as a consumer? As a consumer, my experience. Okay, I happen to use these platforms for women. They're menstrual apps. So, of course, as we all know, you have to give in your information to this app. But in most cases, you find out that, okay, I myself, I think the panelists there said that we do not read the information. We don't read the terms, the privacy terms. You just agree. Me, it is my experience. I don't read these terms of agreement. I don't even know where my information goes. I've not been so well conversant with that, but I am a user of the digital health platforms.
Okay, talking about the terms, well, the panelist here has talked about lawyers using terminologies, hard terminologies, which are trying to explain actually simple things. What do you think needs to change in regards to maybe ensuring that we can be able to understand these TORs, the terms of reference, in using the digital health systems? What do you think needs to be changed? At least maybe if we need to try and see how we can summarize this information in simple terms for the young people. It's like we don't have time. We just jump things over and then go straight ahead on what has taken you there. What do you think needs to be done? Yeah.
Thank you. Firstly, you talked about it, what needs to be done. You talked about summarizing. In most cases, you find out that some of the information is too long. Like what you have to read, you have to analyze, which we would think it is a waste of time. So information, that big paragraph, it doesn't need to be a big paragraph. Let them talk about what I need to know. Let them summarize. Information should be summarized for me to understand it. It shouldn't have to be a long paragraph. Let it be summarized in a language that a layman can understand, I think.
Hello. First of all, I want to note that digital health is one of the interventions that will shape how we improve health outcomes. And for the young people, I believe it's the vehicle which will help us to maneuver or skip the many barriers that are in front of us in accessing health care and other things related to health. I believe young people are best placed to take on digital innovations, because we are the people who are ahead of everyone in knowing the different equipment and tools and other items. Generally, most of the innovations that I've seen around are information-based, and I've not seen many tackling services and other health-related things. Most importantly, we have many apps and many platforms, but how about we help the young people or the different groups to know about them? Most importantly, it's important for us to help them to understand how to use the different apps, and the different, even knowing that these solutions or innovations are actually there. It's important for we can do this through different campaigns and a government coming up, and actually the most important thing is it's important to sustain a conversation on this type of work. That's how we will find the solutions and know where to improve in this area. The other thing is, since health is a sensitive area, I believe I'm interested in the idea of regulation and oversight. Through such conversations, we can know who will lead in these specific areas. For example, certifications, who is going to keep the standards, who is going to is there even a linkage? Who is going to ensure that there's a linkage between the digital related laws and the health related laws, and the different agencies and how they work? The other thing is, I'm very positive that utilization of digital health innovations will shape how we improve access to health for the young people. Thank you.
Okay, so I think we move on to you, William. As a community health advocate, a young person from the grassroots, what is your experience working with young people at the grassroots level in regards to maybe ensuring that they have access to digital health?
All right, thank you. My name is William Chiganda. I'm passionate about health. I'm a community health advocate from Wakiso and a lawyer in training. So my experience, I'm going to give an example she has stated out. Like if these people that develop these digital apps, at least try to develop a digital feature within these apps. Because when we talk about the terms and conditions, you find out that the terms and conditions are almost 1 or 2 pages, but someone is consenting that he or she has understood the terms and conditions within the first 5 seconds to open up that page. That's really impossible. Oh, we young people, we don't really, okay, me, I'm a lawyer, because if you're a lawyer, you automatically have to read. But the young people that we deal with, these young people, they literally don't want to read. Actually, I may have that passion to read, but when I'm incapacitated to read that type of language that they stipulate out. So, at least if they try to develop a video in different languages, for example, English, Uganda, that is trying to stipulate all the terms and conditions in form of a video, not that 2, 3, 4, 5 pages of terms and conditions. And I'm going to still give an example on her. There is that menstrual app. So who is liable? I've not understood the formatics of the app. She's pregnant. So the developer of the app is responsible. Am I responsible? Because I used the app and the app is saying it's a safe day. And I'm like, all right, if it's a safe day, I'm not going to use the other measures. So I guess the developers are trying to get what I'm talking about. So, and what I'm trying to emphasize here, this is the way to go. We are going digital. Everything is going to be digitalized. So in this digital era, we need to focus on 3 or 4 things. For example, the law. What are the laws, as the person from the ministry stipulated? What are the laws that are going to govern this digital stuff that we are trying to talk about? What are these people that are going to manage our data? What have we looked at their ethics, the VHTs? You get? There are VHTs who cause chaos in the villages down there. You get? I know one is, I can talk it here, is in Chileku Health Center. No, Boyogere Health Center 3. That's that side of Chira. Is a trouble cause around the village, but it's the VHT. So can you try to give your data to such a person? So that's why people down there in the village, you will come and you say, I've developed this type of app. You go to the VHT and it's like, how can I trust such a person with my data? Then, and you, the developers, what are you've talked about the principles that govern you. Sometimes when I'm good at listening to the radio. When the banks are advertising, there is that last, customer deposits are protected by the Deposit Protection Fund. At least you get that energy to deposit with the bank. So our data that we deposit with you developers are protected by who? So I think that's my experience. I'll put more when we go to challenges. Thank you.
Hi everyone. So my experience, I've had interface with the information and the service delivery applications. We young people want to be private. We don't want everyone to know what we are doing. We want to do our things our way. So we tend to use the internet to get information. And whatever you get from the internet is gospel truth. Like they say when it's this. So we tend to get different things, and some may not be true, some may be true. So when it comes to applications that provide information in regard to, let me focus on sexual reproductive health. We are private, but when it comes to our sexual and reproductive health, we're even more private. We don't want other people to know. Let me say I'm sick, I think I have a UTI, I think I have an STI. I would not want to go to the health facility first. So I'll ask a question. I have these signs. What do you think I have? What medication can I get? So instead of me going to the health facility, I'll look at this information I'm getting and the prescription I'm getting to go and buy from a pharmacy to treat myself. Yet I may be even treating something which is not, which I'm not suffering from. And then I end up creating more problems for myself. So probably if these applications can be, especially those that provide information in sexual reproductive health, things like that, the information or the people that provide the information should be really trained people, like maybe health workers, to give thorough and accurate information. And when it comes to maybe I have, let me say, an STI or a UTI, and I don't want to go to the health facility, I can go to a lab, I run the test, and then probably send this information to this person so that they get the right diagnosis for me and give me the right medicine. So that I keep my privacy, but still get the right information. Yeah.
Well, I just want to hear your thoughts on this. I'll give each and every one of you 1 minute. Do you think digital health devices and maybe the apps we've been talking about are good for our health? Like, are they creating positive change in our communities? Maybe you'll tell us why you think yes or not, okay? 1 minute each and every one. I'm the father.
Irregulate if you are talking so much. To me, I think these digital health devices are creating impact to a large extent. Just that most youths or most people are not aware of them. I would love to appreciate the developers that are coming up with these apps, because I happen to be working in villages, and I was there and I was surprised that these services, people are getting services down there. I happen to know about living goods, and people are receiving medicine even without them having to walk long distances to go to the health centers. But a person knows that, oh, there is a person who works with living goods, I'm going to go and get the medicine that I need. And when it comes to another perspective, is information is available on these digital health apps. Anything I need to know about a disease, okay, I may know about the signs and symptoms of the disease. And if I know, let me go further and ask a trained doctor about it rather than me treating myself. So the information is there, but we tend to use it for wrong reasons. Because, okay, let me give an example. What she talked about, that there is information, I want to check about the STI I'm having, or I want to check about the signs and symptoms of a person who's pregnant. That information is there. So when I read, I'm going to be at panic because I'm saying myself, it seems I'm really pregnant, because I have read the signs and symptoms, and what I have read is, I'm seeing it happening in what? In my life. So we just have to use this information for good reasons, and not us going ahead to offer the services ourselves, because I can get the information and I treat myself because the information is there, so I try to treat myself rather than seeking guidance from trained health personnel.
For me, I want to say that digital innovations are doing more good than bad. It's just that we need to design more youth-focused platforms. And I've not seen many. I've seen, those that I've seen are only information-based. I think we can do better as a country in having more innovations and embracing this area and investing in it. That's all for me.
All right. William Chiganda is my name again. So, if we are talking about these digital innovations, and the biggest percentage out there are the youth, and we have these smartphones because if you carry out your own survey, almost 99% of the youth have phones. I have a sister of mine. She's in senior 1, but in the holidays she told me, I want a smartphone, and you could realize the reason as to why she wanted a smartphone. But if we talk about these apps that are being developed day and night, during this digital era whereby I can also sit at my home, develop my own app, you get, and I carry out my paperwork, it's approved, you get. Are we trying to understand these people that prevail us with information? Are they really qualified? Like, for example, I gave you the other example of the menstrual app. How are these apps accurate? To what extent are they accurate? You see, we are fighting teenage pregnancies, and then the teenagers have phones. We really don't know, are they accessing the rightful information? You get, because that menstrual app, you end up someone getting pregnant, yet just because he failed to maybe understand something or read something right. And if we are here, some of the people decided to pick the capability phone. For reason being, of course we have to go digital, but we haven't reached a certain extent, you get. And these are the challenges that we've been debating around here. These are the digital challenges. So I personally, I think we still need some more type of innovations in these apps, more energy, and to see that the final consumer of this, Tafuna, like, he doesn't get those repercussions that we've talked about. Thank you.
I think every good thing comes with something negative. So the apps, yes, the digital apps are doing us good, but with that good, there is something bad that comes along. So if we just have to make sure we get the information right. Now, for example, information sharing applications, certain information is not available to people. Like, people access a lot of information via these applications. So the good thing, information is being set out the way we want. We want people not to be ignorant about certain things, so information is set out, and that's good. But then some people don't pay attention to the extra detail to probably use the information right, and that's where the problem comes in. But the bigger picture is, yes, information is out. It's just that small factor that how do you use it that is making this whole thing look bad. But for me, it's a tick.
Yes, thank you so much for sharing what you feel like is going around this digital health and data management issue. But it wouldn't be fair for all what these youth have said and we just leave it like that. I want to give 1 minute to our previous panelists to at least say something. You realize that one of the panelists highlighted on the issue of disinformation being so huge, and I would think that there must be ways as to how such information can be reduced. You realize we are talking digital, and I would think that visuals could work well and all other sorts of things. Someone also talked about was it pictures, to tell someone that you have to tick here, this is more vital, you can't skip a particular item before you accept to a certain point. And then I think that will go to Doctor, how this information can be. I will first read out all the questions, then 1 minute you reply. Then the other issue was about how you target these VHTs. I think Chigundu highlighted more on this. What are the mechanisms when you are pointing out or picking out these VHTs that are supposed to meet and interact with this population? Because the issue was their response, their attitude, how they interact with the community. So how are they, and how do you do all this process? Then I think that we also go to the guys that run these apps. Then the other issue is about, this goes to Lillian. One of the panelists or the youth highlighted on the issue of oversight and going forward with what we call the regulatory frameworks. So how do you see this happen? You highlighted on the issue of EU having these guidelines. How, going forward, how can countries like Uganda or regionally, East Africa or Africa as at large, how can we see that we also have such recommendations and guidelines that can help in regulating and forming regulatory frameworks for this data? And then lastly goes to MOH, the issue of misinformation, because according to what these youths have highlighted, especially the conversation and that whole thing that was it Chigundu talked about, how sure am I that the information I'm getting from these various apps is authentic? Because we know all there are issues of cyber that go on. Someone can enter into Mobile Clinic's app, but also away from that, does NITA Uganda hold a department that we can say that this is specifically for health-related issues? And once these apps are developed and the information that is on these digital apps is authentic for the consumers. So I'll give 1 minute, please. We are not doing well with time to respond to them quickly.
Thank you very much. So I'm responding to the question on how to make the terms and conditions more practical for the users. First, with advancement in technology, there are many things coming up, and some of these features we've used them. So if someone is not willing to read, you can listen. So if, let's say, there are terms and conditions and you don't have much, you don't want to strain your eyes a lot on the screen, I think you can deploy the Google Assistant to read for you. I think it can help solve some of the challenges. Use the Google Assistant. Secondly, of course, I understand that terms and conditions are legal documents and they are explaining a lot of things. I won't say that they are using a lot of words to mean simple things, but I'll say maybe they are necessary in the legal frameworks. So maybe they could be summarized and then given an option to read the whole thing. So they give you an option that maybe these are the terms in general, and then the details below. So at least if someone doesn't have time to read all the terms and conditions, the key points are summarized somewhere, and at least they can get something that this is what I'm signing up for. And lastly, another thing that I would also recommend, of course, I don't have like solutions to this, but because I don't create these terms and conditions, but these are also my recommendations, and I totally agree with what the youth have said. So lastly, the terms and conditions should be very, I don't know, they shouldn't be enforced in their whole. They should be broken down. Someone could agree to certain things and then may not agree to other things, and these should be reflected on how they are going to use this service. Let's say if, as I walked in here, I was asked if I agree for my picture to be used during these proceedings, and I agreed with that. So the same could apply. That if you're giving out this information, do you agree to sharing your contact, to sharing your picture, all that? I think they should offer, terms and conditions should offer such options for the users of these various apps. Thank you.
Yes, thank you so much, Doctor. I think Dembe will come next.
I think I'm answering the question of VHT, the VHT ethical standing. Yeah. So at Mobi Clinic, we try to make sure that we are onboarding VHTs of good ethical standing in the community. We are aware that these are the first points of trust in the community, and that's why we work along with the leaders who might be knowing these people. But also, in recent times, we partner with the CAO at district level, and also the DHO. So we don't work in isolation. We work with the leaders who are in better knowledge of these individuals. But also, even in the course of delivery, we have feedback mechanisms where people are free to complain about somebody, and the same, if people are praising someone, at the end of the day, there can be a reward of that. At the maybe end of the year, that will become the area leader within the VHTs, for Mobi Clinic side. But also, if there's a complaint, then we can also do away with a certain person if complained about. We have done it before, so we are aware of how critical it is for these people to be in good books with their communities that they serve. Thank you.
Thank you so much. I think he will come, then Lillian comes last, if it is okay.
Thank you very much. I think I needed to respond to some of the questions. One, is it Gloria? Florence, about privacy and then access to health. Yes, so in as much as we want to be private, it is important to really mind about our health. Yes, so our health-seeking behavior shouldn't be affected by our fear for our privacy. Yeah, I know it is true that the youth want their own private solutions. They prefer living their own lifestyle the way they want. But at some point, when you're in pain, when you're in need, or when you're sick, priority is about regaining your health, restoring your health, then the rest will come later. Yeah. Then there's an issue talked about by this gentleman here on this end about health workers being trained, and then I think William also added on to it to say that the people who push out this information, yes, should be trained people and should be able to put out good quality information that is very reliable and informative. Yeah, that I think is very important. But again, like I earlier said there while I was putting out and explaining my disclaimer is, for instance, now me here, I'm a Gava. If any position that needs to be communicated on behalf of the ministry, there is a whole communications and PRO department. So whenever this information is coming out, then these apps that have been approved by the Ministry of Health, someone responsible and in good knowledge and understanding of those concepts does the communication, not anyone, except for the few apps. Some of you are confused by the other apps in the health space because not all apps and systems that are there are approved by the Ministry of Health. Some are there operating illegally. Yes. Then I think the one he was directing to me is an issue of self-medication, and it also came from the other lady. So this information that we get once we want to access the virtual solutions, I want you to agree with me. If you have read very well, once you access this Google and whatever, they will not give you information about prescription. They will at least give you the drug description, how the drug works, what it treats, but they will not give you prescription of the drug. What we encourage is that you access the information, but for you to, like she highlighted, for you to get treatment, you should not do self-medication and clinical diagnosis. You should go walk out to a facility for a confirmatory test, and then you get medication that is supposed to address that confirmed issue, not a suspicion. I don't know if I missed something from you, or if that is all.
I think that's all. Maybe for the issue of misinformation, that was my...
Yeah, misinformation is what I earlier talked to, is once you pick this information, and it depends on the source where you pick it from. If it is from the accredited sources, the approved sources, then we are fully responsible, yes? But like I told you, there are solutions there that are operating illegally. So we do not control the information they pass out for and on behalf of the Ministry of Health, and we are not aware of that information. So we don't control their apps, because anyway, they are not approved and known to us. Yeah, so, but for the apps that are known to us, approved, and the systems and the dashboards, that information is controlled and checked against for quality. Yeah, thank you.
Thank you so much. We shall have views from Lillian, and then the next item on the agenda. Thank you.
Thank you, Mr. Moderator, and thank you to the panelists. I was listening keenly, and once in a while I would throw a side smile. On the issue of regulation, I earlier mentioned the General Data Protection Regulations, and these regulations, much as they were developed under the European Union, they apply almost globally. They have been adopted, by almost, every country. So, like I earlier said, in Uganda, our Data Protection Act speaks to these regulations. There's a particular clause that, article that, mentions, a section that mentions that we are compliant to these regulations. But maybe to throw more light on them, they focus on mainly two issues. And that is to do with personal data and data processing. So in regard to personal data, they are clearly directing at any information that may or indirectly identify an individual. This includes your name, addresses, and ID numbers. So when we see, for instance, how much data is collected on you, usually I'm very sensitive when I come, enter, say you see these security companies. Even when we're entering here, there's a book, and someone is recording your information, and in there, there's some even collect email addresses, but they have your email address. So when it comes to data protection, to what extent are they going to protect my information? The data I've left there. So that is what this kind of, the primary focus. It also looks at location, IP addresses, and cookies. So I don't know if we know cookies. When you go to our website, there are those tracking, they track every single click that you make. So in the past, websites would just, had these things inbuilt behind. They're still there. And every single click, they will kind of, personalize or automate what you're looking for. And they sell that information to someone else, and that is how business is done online. When you go to these social media companies, they feed on data. They feed on what you give them. Whenever you click, whenever you do a Google search, that information, Google is going to get it because they sell that information. They make money through that, targeted advertising. So that's why at times when you open some websites, you see flashes, Someone is clickbait, someone is telling you, click here, you click there, they have made money because you know what? They are paying this website to place that ad there. So the GDPR looked into that. Right now, how much information can you collect from users? So even if it is to do with digital apps, especially the web-based ones, if you open a website, right now you'll find there's a notification you get, accept cookies, all cookies or some cookies. And that development came just in 2018. So currently, this is the kind of information that, is being looked at. When it comes to reading, those terms and conditions, we've done a lot of research in how much data can you give out, When it comes to, before we used to say that companies that develop these applications, whether it is digital, whether it is agriculture, they do not tell people how they are going to protect their data. And when that was there, then there was the issue of, if I put in my data, you may say that for us, we put in security, we've built, our system is secure. But if the user at any one point, if someone got hacked into your system, how is the user protected? So before, you're even lucky that now, you have those statements come out. They were even in small letters. You do not have time to read. Under my culprit, I would go and I would just click OK and move on. But then the more I got to use technology, I would find myself, at least I tried to go and look at some. And of course, there has to be the issue of trust. Most of the platforms that we use, that they have gone through rigorous research and analyzing what users want. Where they fall short, there are these other people who are going to come and advocate, and there's the law requires them to protect their user systems. When it comes to developing new apps, I know Mr. Agaba mentioned the pandemic of apps, which is a problem. There's the issue of IP, intellectual property rights. Who owns this? Dr. Mira has also mentioned that there are so many illegal, and also Agaba, there are so many illegal apps. How do we control this? Because if it is illegal, it's not going to protect your data. So then here it comes to the issue of misinformation and fact-checking. There's a lot of pandemic information, in terms of app. Right now, everyone is a specialist. You go and you search how to cure a headache, you get like 1,000 or tens of thousands of information. But it is for your duty to verify which information I'm going to look at. I use health apps, and most of them, the genuine ones, they'll tell you that consult your doctor. This is just giving you advice, this is not giving you the final say. But on the terms of regulations, financial data for the GDPR is protected, health, genetic, biometric data, data on race and ethnicity, political opinions, and sexual orientation. This is personal data that any regulation should be able to state how are they going to protect this data. So that is stated in the GDPR, and it should apply to all laws, and Uganda does provide that. If you get time, and which you should, because we are looking at digital information, digital innovation, take time and look at the data protection law. Take time to look at the DPO, the Data Protection Office. It has a website and it has specific sections. Who is collecting your data? Who is the data collector? Who is the regulator? Who is the controller? How your information should be governed. The other aspect of the GDPR looks at data processing, who is collecting, when you're collecting data, what should be there? When you're recording, when you're storing, when you're organizing, structuring, altering or using or erasing, to what extent or at what level do you go and say, I should remove this data? If I've collected this data, it has served, its purpose, then it's time to let go. I think Mr. Gaba mentioned something earlier in the conversation of how do you have you finished the purpose? What is the purpose of the research? For instance, if you're doing research, and at what point are you going to erase this data? In the law, that is also provided. So back to you, Mr. Moderator, we do have the law is there. The issue is awareness. People don't know how the laws protect them when it comes to data protection and privacy, especially online. But also this also applies offline because the Constitution provides for the right to privacy. And these laws, kind of fall under that. At the regional level, last year, the Africa Union developed the Africa Union Data Privacy Framework. And this framework is to aid countries on how data should be governed. Governance is about ownership, it's about storage, it's about stewardship and all that. So in most cases, when we are looking at that, that is the bigger framework that we are looking at that is guiding anyone who is in Africa and is part of the Africa Union, and they are yet to develop a data protection law. The framework is there to offer them guidance on the different modalities on what to take in addition to the global general data protection regulations. I hope that answers our question. But for the issue of the terms and conditions being many, some companies like say Apple, when you download like something, that's struck, they give, and it's now actually more, the text is more visible than before. We used to have mobile companies, they collect a lot of data, but they did not have those privacy statements. And that is like 10 years ago. Right now, the private statements is there. So it is our responsibility to know how is your privacy protected by the different platforms that you're accessing. However long it is, look out to that. But I think on the issue of tracking and cookies, it has been made more simple because you can decide, it is up to you to choose whether you want to be tracked or not. And that comes when you're using the different web platforms.
Thank you so much, Lillian. Alim, I don't know how we are running with time, but the government has something to say.
Yeah, thank you. So, I felt I should say something about the terms and conditions being lengthy. It is not true that is what is exactly limiting people from understanding what is enshrined in those terms and conditions. Because you'll agree with me that the interest for getting to the app takes precedence. At that time, for you just want to use TikTok or Facebook. Regardless of the conditions and the terms you're determined by hook or crook, you will have to access TikTok and use it. So if you have seen the permissions where they ask you if you allow the app to access, for instance, contacts, to access the camera, and people just have to accept because they have no option, but they want to use the app. And in the long run, we end up providing private information freely. So it is not about them being so lengthy. For instance, with the new technologies, there are even audiovisual enablers. I've seen like the Braille Apex Reader. This enables the blind to use the computer like me and you, the temporarily able-bodied. And for them, they can also do emailing and surfing the internet and all that, like any one of us. So all those things are there, and like what he said now, even with the Google can help you read if you're too lazy for that. But me, I want to believe it is not the reason why we don't read. Yes, for us, your interest takes precedence, the reason for wanting the app. Then, what she kept hinting on, under Regulations 13 for the data protection, it says that everyone, the data collector, data processor, and data controllers who are dealing with personal data of all Ugandans within and outside Uganda are required to be registered with the Personal Data Protection Office. So, and most of us, and some of you even have the apps, do not take care of these things. They don't even know about them. So, awareness. We have to speak a lot about awareness. Thank you.
Thank you so much.
Someone has. We are coming to the last session.
Hi, I didn't really necessarily a question, but it's just that so many questions have already been raised. I don't want to add on to the questions, but I just wanted to highlight on some of the issues that have been raised during the discussion by the panel discussion of the youth. Personally, I'm a data enthusiast, and I think last year is when I last did data collection. So usually we do something like high frequency checks. So those things of where somebody reads agrees, lies that they've read the terms and conditions in seconds. So usually that data is killed, like it's useless. They can't use your information to market their product. Then maybe the other thing is usually when we'll be hired, you have to have a certificate of clinical research, something like that practice, that they have to ensure that you actually know what you're doing, what to do when you encounter some challenges collecting the data. Like say, for example, if you're interviewing a person and you're asking them questions, you have to look at their demeanor and know, is this person really in their right mind to answer? You also have to read the environment. Sometimes you'd go to homes and maybe they've had a fight, or if you're asking them about their assets, you know, in some homes, like some people hide their assets, like the wife, so they would advise us to separate people. Now, since this is about health, like when you go to the hospital, you know, our mothers kind of like being nosy, and it's for that very reason I wouldn't tell them that I am sick. But mostly because also your diet would change, no more eating chicken and all those nice things, so you'd hold back on disclosing that you're actually sick. But anyway, that's a story for another day. So usually what I've seen in the good hospitals, they get you away from your mother and they ask you separately, are you sexually active? Those things, because you know, for a girl, when you're sick, they don't immediately go to checking whether you're sick. They first confirm if you're not pregnant before they give you any medication. So I think all these practices can just be incorporated into the digital apps instead of like trying to hit there and there. And then maybe the other issue that was highlighted is people understanding how to use digital platforms. Personally, all the platforms that were talked about here, I've never heard of them, I've never used them. All the platforms, the digital health platforms that I've ever used before are by outside foreign parties. So I think ideally, before we even go to that person in Vuyikwe or Gulu, you as you who is learned, how able are you to spread the message or to pass on this information to the person next to you? Because I know very many young people who can't speak English because they've had other people speaking the English, especially in northern Uganda, but they actually can't write or read that very same English that they're speaking. Then maybe the other issue that was highlighted was the certification by medical professionals. Yes, these digital platforms are coming up to help people down there in the villages, but the app, I have an app, it's called the Flow app. It tracks menstrual health, but to access information by professionals, the doctors, from the doctors, you have to pay a certain subscription fee. So I think a doctor had earlier mentioned about how some people create the apps to get money, then others to help people in their society. So I think that means we need to create something like whistleblowers or people who actually moderate to make sure that, yes, I've downloaded this app, but like the basic information, I can access basic proper health information from a health professional before having to pay money first to access that information, because then there is no use to me having the digital app. It's better I pay my money, go to look for the nearest hospital and get that help. Yeah. And then maybe the other issue was for the alignment to the other sectors, not just the health sector and the ICT departments. Of course, the government is there. It has its own key performance indicators, targets. I think, I've forgotten your name, sir, pardon me, but you mentioned that the government has all these facilities in place. But me, I don't know those facilities exist because I only have her contacts. Currently, I only have her contact. So I only know all she knows. But if there is like a forum or a committee of people who are placed in these organizations, one in the government, one in the ICT hub, one in the hospitals, one in all these other areas, education and whatnot, and even the CBOs and the non-governmental organizations, the private sectors, that committee of those individuals, both young and old, who can give current information and keep the rest of them in their circles updated, that this is what's happening. We have the same targets. I think it would go a long way, other than us punching holes where they are actually not. Like it's like punching a hole through a wall and somebody immediately comes and patches it up. Oh, that's already done. It would go a long way in us moving forward.
Yeah, thank you very much. We have papers. There are papers around. Everybody has a paper. We request that you write your questions or any emerging issues or anything that has not been discussed, and we'll try to have them answered, and the answers will be available on our website, or even during our lunch time. If you're having lunch with this person that you think can be able to address the issue, then we can be able to address that. So kindly utilize those papers and write something, any emerging issue, any question that you'd love to ask, who you are targeting it to. That will be very helpful so that we close this session. But before we close, I would like to thank Ahaki for hosting us today. We thank the management for all that has been done to make the day very successful. The youth, we are very grateful that you came. The ones from Public Health Ambassadors, the ones from Reach Out a Hand Uganda, the ones from SEHAD, the ones from Peer-to-Peer Uganda, the ones from Uganda Youth and Adolescent Health Forum. We cannot forget the ones from Wakiso, Community Health Advocates, and then the Uganda Network for Young People Living with HIV. Thank you very much. And then our panelists from Ministry of Health, Mr. Agaba, thank you for coming. Dembe, we are very happy to have you from Mobi Clinic. And then Dr. Miro, thank you. Lillian, we cannot forget your information that you have actually provided to make this day successful. And I will call our head of advocacy capacity enhancement to close this session, and then we can be able to take a group picture before we go for our lunch. Ibrahim, you're welcome to close the session and give closing remarks. Please be energized, have smiles, because after his remarks, we are going to take a group picture and then we go for lunch. Thank you, everyone.
Thank you so much. A good afternoon to all of us. On my behalf and on behalf of Afya na Haki Institute, we extend our appreciation to each one of you for accepting our humble invitation to be part of this interesting conversation on data migration. Data migration is an interesting subject, not only among the youth but across the different groups. Something that touches lives of all of us. Even all the people have smartwatches and smartphones, and they use gadgets which were put there at the start of the session, which means that data migration is a subject for all of us. Though today's discussion has been unique for the youth. You have shared very interesting insights. To our panelists, you have a wealth of information you have shared. We hope that we'll build on that to have further conversation such that in the future we have standards on digital health across sub-Saharan Africa, such that we have patients or users of health apps or provide health information to have assurance that their health data is secured and there are safeguards, and in case they have any challenges, they have for us where they can go and seek redress. On a special note, we thank the University of Warwick for this interesting collaboration with Afya na Haki to undertake research trainings and enhancement initiatives on digital migration. We take this collaboration as very key for us as an institution, and we hope to work with each one of you to be able to take forward the conversations we had today. So this is not a one-off conversation. We hope to have so many conversations on this interesting subject matter, but since we have time limitations, we cannot continue today and tomorrow. So we'll have, this has been a startup conversation, but we hope to have series of conversations on this important subject matter. So on behalf of my colleagues who are here, we thank you so much for helping us coordinate this initiative. The partners which my colleague shared, we thank you so much for accepting to come. We are sorry for the health workers for getting you off your schedules, but also for the other panelists for getting off your desks to come and spare time. We don't take that time for granted. We thank you so much for coming, and we pray that you reach your destinations in a safe way. Based on the guidance I received and the instructions, I declare this meeting closed. Thank you.
Fatna is going to lead us to have a group picture. Where are we taking the picture from? Outside. So we can, and then we go out and have a group picture, and after that we shall go straight to Renzori Terrace. It's up, and that's where we shall have our lunch. Those ones, Aksam is collecting them. Please give them to Aksam.